Good evening. My name is Shireen Hatcher, and tonight I want to discuss with you why I feel like hospitals, clinics, and other medical facilities need department liaisons for the LGBT community. First, let me give you a little bit of the background. 30% of bedside nurses reported feeling uncomfortable taking care of the LGBT community. If nurses feel uncomfortable, we can imagine what patients must feel. 80% of nurses had no LGBTQ training while they were in school. 18.7% of teaching staff felt uncomfortable teaching LGBT topics, while 80% feel that the LGBTQ healthcare topics were not important in the curriculum at school. Some healthcare professionals refuse to even touch patients, always, sometimes blaming them for their own health care, using harsh and abusive language towards them, and even sometimes using physical abuse. Back in the 1970s, LGBTQ, or back then LGBT people were subject to things such as electroshock therapy and things of that nature. It wasn't until 1973 that homosexuality was listed in the Diagnostic Statistics Manual as a mental disorder. Transgender identity is still listed in the DSM-V as gender dysphoria. Now, we all know that homosexuality is not listed in the DSM-V anymore as a medical disorder, but transgender identity still is listed in the DSM-V as gender dysphoria. As medical professionals, we need to understand that all people do not fit into one small box. That's why it is important for the medical staff, personnel, to understand that you have all kinds of people and everyone is not the same. So with that being said, there's no wonder why our LGBT community is not comfortable with coming to the doctor, coming to a hospital to be seen. 28% of transgender people postpone their care in fear of being discriminated against, in fear of not being known as who they are, not being addressed as who they are. 19% of those that sought care were refused treatment. If you're being refused treatment, some say, why even go? Why even go to a doctor or to a hospital or any kind of medical facility if we're going to be refused care? 50% of transgender patients believe that medical staff are not properly trained to take care of them. As you can see from my previous conversation, that how can they be properly trained when 80% of teaching staff believe that the LGBTQ curriculum is not important? I would have to agree that medical personnel are not properly staffed from a personal experience of my own. I currently work in the hospital at the moment in the PACU. The PACU is where patients come out of surgery. When they come out of surgery, they come in the PACU for recovery. We once had a transgender patient. That patient came out of surgery. The nurse that took that patient addressed that patient as a sir instead of addressing that patient as a ma'am. Of course, this was a transgender male to female, going from male to female. So we all, as you know, that when you're transitioning for transgender personnel, when they're transitioning, they like to be addressed as who they feel that they are. This particular person felt like she was indeed a she. And when the nurse addressed her as a sir, that patient shut down completely. All kind of forms of communication was shut down. That patient felt like they had been disrespected. So there was no more communication in order for the nurse to be able to take care of the patient. It wasn't until I myself came over to speak to that person, to talk to them and address them properly, that they were able to open up the lines of communication and get the proper care that was desired. This is why medical facilities need to have department liaisons for the LGBT community so they can better train medical staff. Thank you.